Dr. Becerra, how are you today?
I'm doing great, thanks. How about you?
Good. Thank you so much for being with us today. We'd like to ask you a few questions, learned about you, and learned about your work with the Latino Caucus. Can you share with us, a bit about yourself and about your role with the Latino Caucus?
Sure. Right now I'm an assistant professor at Loma Linda University School of Allied Health Professions. I do research and I also teach statistics and research methods. I've been involved with the Latino Caucus since I was a student while I was finishing up my doctorate in epidemiology. I really got able to be part of the development committee. So that's kind of the fundraising part. And from there, I went on, I learned more about the caucus and all the activities that we do and who we're connected with. And when I saw the opening for treasurer, I decided to go up for that one. So then that's kind of how I got involved. Yeah.
Great. So tell us more about what is the Latino Caucus role or work, and what is its connection with the APHA?
Latino Caucus for Public Health, we kind of have a broad role, and I like that we're going more towards connecting with the youth. So, not necessarily youth as in younger people, but people who are maybe young professionals or just starting out in their careers. So, we've done a lot of work now. You can see how we have a Young Professionals Committee chair, and we're starting to have more events related to that. I try to recruit people who are not necessarily let's say seniors in their field, but people who are trying to earn more experience. We have like an accounting intern, we have a fundraising intern, and they're at like the undergraduate and graduate level. And the benefit of doing that is that we bring in a whole lot of new information, new ideas to the caucus and to the joint collaboration with APHA. So.
Great. It's interesting you mentioned the young crowd, young professionals. Why is that important for public health?
The young professionals clearly drive the future. A lot of issues that we deal with now, they're going to be the ones who, if we don't help them get to that point, they're going to be the ones who have to deal with it later when they're, I suppose, in our career stage. So it's really important that we don't have this gap where we just kind of deal with things that we feel like our own generation, and we don't involve the people who are earlier in their careers. So I think that's kind of important to kind of bridge the gap like that.
Fantastic. And where do you see the Latino Caucus going? What is the direction of the Latino Caucus? What are some of the goals for the caucus?
I think some of the goals include further engagement, and I think we're starting to see that now with like a broader social networking campaigns, more inclusion of young professionals. We're starting to incorporate more technologies. We got certified with TechSoup, which was the organization that allows for kind of low or free products and services for nonprofits. So that's going to give us more ability to kind of reach wider audiences and then connect with them as well. That's why I see us going. We're just going to keep growing and growing. And I believe we're even talking about having like local student chapters. So I think all these tools, this technology is going to help us to kind of connect and kind of make it more cohesive throughout the country.
Fantastic. So you're talking about the Latino community and the Latino Caucus. Can you share with us a bit more about the Latino community? What are some of the issues that might be different from other communities? Talk to us about the Latino community.
Definitely. One thing that I noticed, and I'm a professor, so I regularly engage with students. I see a lot of barriers at the education level, and I think there's a lot of actually opportunities because right now, I would say a very great strength of the Latino community is like the family. It's the connection with like your relatives and just the friends. That's a big network. However, what I've noticed is that sometimes young professional students, they feel like they need to give everything that they have now, and there's less of investment in their own future. So they're struggling. They're having 2-3 jobs at the same time. They're trying to pay their parents' home or like bills. At the same time, they're trying to do full-time work. So I think we need to support that. We need to understand that, okay, we can't view all these things as barriers. We need to see how can we come back and leverage those things in order to provide that support to them so that they can be further up, develop in their careers. So then I think that's where we need to be.
So it sounds like the Latino communities and your interests are pretty much around young professionals, students,
Yes.
and in public health. So what would you like to, be the takeout from this interview, or what would you like to share with people who are listening to to this interview? What are some of the main points you want people to take out of this conversation?
I would say that as easy as it is to get kind of caught up in your own career path. So if you're a professor, you might be working on trying to publish or trying to get a grant or trying to get tenure, and it's really easy to get caught up. And then you go and you teach, and you forget that you were in that position once too. So I feel like we need to go and kind of go back and take a step back from our own careers, our own what we're doing, and realize, okay, this pipeline needs to continue. We have to go back and look at who we're about to mentor, and make sure that they can end up on the right path too. Or else, if we have that break in the continuum, then it's not gonna work. We need to have continued mentorship throughout.
Wonderful.
Yeah.
So thank you so much for sharing with us, Dr. Becerra. Really appreciate for your time and and your passion and your interest in young professional students and the Latino community. Thanks.
Perfect. You're welcome. Thanks.